All right. Hi, everybody. It's Katie Harris. I am owner and nurse practitioner at the Philly Wellness Center, and we're going to get started in just a minute here. Just getting set up, and we're going to be talking about regenerative therapies for pain relief. So very excited about this because there's a lot to talk about. There's a lot that is going on, stuff that you may have never heard of before. So very, very excited to share this with everybody. So I am going to go ahead and get started just in the interest of time and keeping everything on schedule here. So how the mouse is back here. All right. Awesome. Just want to make sure that you guys can see my screen as I move. Yep, absolutely. All right, awesome. Okay, so pain is endemic. So chronic pain affects more Americans than diabetes, heart disease, and cancer combined. And if you're one of those patients, you know this all too well. Pain it's one of those things that we've become so accustomed to pain that people don't even talk about it in a lot of ways. I've had a lot of people come into my clinic and we've gotten some new therapies and software and different things that we can do. So I started asking people about pain, and it's amazing how many people come out of the woodwork with pain symptoms and pain issues that are debilitating. Whether it's low back pain, neck pain, shoulder pain, joint pain, fasciitis, like a plantar fasciitis, Achilles tendonitis. There's a lot of different pain therapies and pain modalities. And we tend to suffer with them a lot. And the pain it's very important. And we'll talk about some of the features of pain and what we need to know. But it is a very important component of our everyday life that can be addressed, and there's a lot of different ways to address it. Now, the solutions that we have relatively been, I'm going to say, not the greatest. There's a few solutions. A lot of them are around medications. So we will talk about some of these medications and my thoughts on them as well. And, they may have a purpose. They may have some sort of role to play, but this should not be a long-term solution. So we have the whole opioid class. And as you are well aware, there's problems with addiction, dependency. If there were ever a gateway drug to heroin, it's opioids. And you can get them quite easily. I would say the 90s, 2000s, we had a real push for, opioids as a solution, really kind of pushing that on people that potentially didn't need it. I know my dad recently went to his GP and he doesn't even have pain, and they wrote him a script for oxycodone. And, I was like, what exactly is this for? So it's still being prescribed quite significantly, despite the fact that we know how dangerous opioids can be. Now, NSAIDs are another one. So your any type of Aleve or Advil, because it's over the counter, we think of it as being, not too bad, and we prescribe it in the hospital all the time. We do NSAIDs and Tylenol. And ever since really getting into this field of wellness, that, I've really appreciated really the downside of NSAIDs. So they are known to cause ulcers. So that is a huge problem, especially if you already have gastric problems, gut problems. So ulcers are very serious. You can absolutely die from ulcers. They can perforate, they can cause bleeding, they can cause all kinds of damage. The NSAIDs will attack the kidneys, so you do get kidney damage from that. They can increase heart attacks, strokes, liver damage, and again, destroying the gut lining. And the gut lining, really a lot of this is going to come back because we're going to talk about the mechanism of pain and why things are happening the way they are. So NSAIDs do destroy that gut lining, and that's a big part of the inflammatory response that causes additional issues. Steroids, I had to talk my dad out of getting steroid injections because he's getting them in his back and his knee, and yeah, it feels good, right? When you get a steroid injection, that first one, it does feel good because it's anti-inflammatory. It really calms down that area. But what it also does is it destroys joints. It breaks down cartilage. It increases your blood sugar. It worsens osteoporosis. It can also worsen your osteoarthritis. And worst of all, it's an immune suppression. So steroids suppress the immune system. You never want this. Like, your immune system is like one of the few things in your life that needs to function 24/7 and be on high alert. Because without your immune system, you're really screwed. And so every time you take steroids, they have their place. So sometimes you just have to do it, but as a routine way to manage joint pain, steroids are really, really, they're just bad news. Now, acetaminophen, another one of those medications that, because it's over the counter, we don't think too much of it. You take a lot of it, maybe it's better than NSAIDs, but I think acetaminophen is worse. It's toxic to the liver. It also depletes glutathione levels. So glutathione levels, you need glutathione to minimize and reduce oxidative stress. And oxidative stress is one of those things that oxidative stress is a byproduct of energy creation in the body, right? So every time you make an energy molecule, the byproduct of making that energy molecule is oxidative stress. And in a normal human, right, in a normal scenario, you have glutathione levels, and glutathione will it'll neutralize that oxidative stress. But if you have too much, right, if you have too much oxidative stress or not enough glutathione to neutralize that oxidative stress, then it becomes a massive, massive problem. And that's where you get increased inflammation. You start getting mitochondrial dysfunction. Your triglycerides go up because your mitochondria is not working. And it's just cycle of a circle of events that just keep perpetuating themselves and make it worse. And then if you already have, like, let's say you're taking lots of acetaminophen, you're depleting your glutathione, and you have a stress event in your life, something happens, well, you have like zero reserve capacity because you can't even deal with the oxidative stress that you have because you already have acetaminophen on board that's depleting your glutathione levels. So when something happens, it always becomes the straw that breaks the camel's back. So it's like that one additional thing that the body can't handle. Acetaminophen also leads to leaky gut, endocrine disruption, all kinds of problems. Muscle relaxants, again, these can be addictive. I've certainly seen that in my years working with neurosurgery. We did a lot of muscle relaxants, and I would get some angry people calling me demanding that I refill their prescription because, it's like 3 days later, and it was just kind of like, well, you can't have more until 30 days out. And it was awful. It was, you feel really bad for these people because it is addictive. And, they're in a lot more pain without it. But you're in a rock and a hard place. But another problem with muscle relaxants, especially like Flexeril, they're anticholinergic. And I'm going to explain what that means in the next slide. But that is hugely, hugely problematic because it can cause memory loss, and it can lead to dementia and brain fog and cognitive issues as well. Same with some antidepressants, not all of them, but some of your older ones in particular, like your MAO inhibitors or tricyclic antidepressants are also anticholinergic, which causes brain fog and different issues. And then, of course, there's alcohol, which is also another way that people deal with pain, which is quite unfortunate. So let's talk about the cholinergic system for a second. And you're probably like, what does this have to do with regenerative medicine? But it actually has a lot to do with it. So the cholinergic system deals with a neurotransmitter called acetylcholine. And if you don't know what acetylcholine is, it's one of the most important neurotransmitters in your body, and it's responsible for memory, learning, and attention. So that's all driven by acetylcholine, which plays a really, really important role of communicating with your neurons. Okay, that's priority number one. So if you want to remember things, right? If you need to recall something like where are my keys to my car, you need acetylcholine. So when you take anticholinergic drugs like muscle relaxants, such as Flexeril, Trazodone, and your tricyclic antidepressants, those are anticholinergics. Another very common anticholinergic is scopolamine. And they used to use scopolamine to confuse older people and then steal their money, and because they would forget. They'd have difficulty remembering while they were on scopolamine. So very, very common. If you have people that take like Atrovent, those are anticholinergic for asthma. They will have that problem as well. So if you do have somebody or yourself and you feel like you're on a brain fog or you have memory issues and you're on anticholinergics, you need to look at coming off of those, because that is a very, very powerful inhibitor of memory. So your acetylcholine levels, in addition, will naturally decline with age. So it's just accelerated exponentially when you're taking anticholinergic drugs. Stress can also knock out your acetylcholine system. And these can lead to neurodegenerative diseases like Alzheimer's disease and dementia. So, when you're talking about pain, you're talking about the cholinergic system and anticholinergic medications to treat the pain. These all are wrapped into one thing. So one of the biggest, I would say, telltale signs of this is that, Alzheimer's patients, they have up to 90% less acetylcholine in the brain. That's one of the hallmark signs of that. So 90% less acetylcholine. And the drugs that they use for Alzheimer's, such as like donazepam or Aricept, their mechanism of action is to increase acetylcholine, right? So you have to make sure that they're not on any anticholinergics and that you put them on medications that will help increase acetylcholine. And they do that to help slow the memory loss. There's a lot of other issues that go on, obviously with Alzheimer's disease, but that is a core function, and it's one of the first things to go because your recall memory is very, very fragile. So you might remember long-term events, but recall is very fragile, and it's dictated by acetylcholine. So chronic use of anticholinergic medications, such as muscle relaxants, sleep aids, antihistamines, antidepressants, they can also increase your risk of dementia up to 50%. So these are not benign drugs. We use them so commonly that we don't think that much of them, but they can be very, very dangerous. Even short-term use can cause brain fog, confusion, and difficulty recalling information. Low acetylcholine also contributes to poor concentration, forgetfulness, and attention deficit. So if you're on any of these medications and you have those symptoms, you need to talk to your provider about it. So ways that you can support the cholinergic system and improve memory and brain function, and this really in a inadvertent way will help with pain, but you want to eat choline-rich foods such as eggs, beef, soy, sunflower, cholinergic. There's acetylcholinesterase inhibitors that prevent the breakdown of acetylcholine. Lion's mane mushroom. If you get those types of supplements or you like mushrooms, lion's mane mushroom is really, really good and supports the cholinergic system. Avoiding those anticholinergic drugs, and exercise always helps with natural acetylcholine production. So pharmacological solutions, they may have a role in pain management, in regenerative therapy, but they haven't really addressed the root cause issue of what's going on in the first place. The best they seem to do is mask or numb pain and distract us with other issues. So, maybe if you can't remember that you have pain, that's helpful, but it's not a solution. So in the 1800s, and I've worked neurosurgery for many, many years, and I remember this story. But in the 1800s, they used to do, when people had really severe pain, they would do what they call like a lobotomy. And they would take, and this is somewhat crude, but they would take a surgical instrument and they would scrape the top front of the brain. So they go in through the nose, that's how you can get to the brain, and they scrape the top part of the frontal cortex. And, people stopped complaining of pain. So they're like, well, this is great. And they did this for a long time. Not just like, they didn't do it just once or twice. They did this for like 50, 60 years. And then somebody had the great idea of asking people, were they still in pain? And these people would say, yeah, they're still in pain. The pain didn't go away. They still had the pain. They just stopped complaining about the pain because they didn't have an emotional response. The frontal lobe is responsible for that emotional response. And when they did the frontal lobotomy, people just didn't care that they had the pain. They still felt the pain. The root cause was still there. They just didn't care. And that's what a lot of these pharmacological agents do. They are blunted chemical responses that, make you not care, right? Alcohol affects the frontal lobe of the brain, and it's like a chemical lobotomy because when you drink alcohol, you numb the sensations, and potentially you don't care so much about the pain anymore. So something to, just to think about, because the pharmacological agents that we haven't been the best. So there's three main ideas that we're going to talk about during this webinar. And one of the big one is going to be what happens during pain transmission, because I come from the perspective that you need to understand pain in order to treat it. We can certainly just do stuff. And you're certainly welcome to skip the webinar and just call us at Philly Wellness Center, and we're happy to do stuff. But I think it's important to know what it is that we're doing and why we're doing it and why it works. Because pain is essential. Pain is an essential sensation that we have, and it alerts us to so many things. We need to know about pain so that we can fix it, right? If there's pain, there's a problem. So you need to be curious about that problem and how do we fix it? The therapies we have don't actually fix the pain. They can numb the pain. They can distract us from the pain, but they don't actually stop the transmission of the pain and fix the initial problem. So there might be a million different sources and manifestations of pain, but what's interesting is that there's really only one path to health. And if we can follow that one path, we should be able to fix the issue. Finally, we'll talk about therapies that are old and some that are really new, and then maybe they've been forgotten or what I call fringed. But we'll and a lot of these therapies that have been around for like 100 plus years, they fall out of favor because there's more exciting big pharma medications that we can do. But as I've shown you, a lot of those medications that we have are actually doing way more damage than anything. So for those of you that don't know me, I'm Katie Harris. I am the owner of Philly Wellness Center, and we are located on 8th and South. And one of the things that I find really interesting and really exploring is perpetual health, and looking for a point of convergence into health and not focusing on the divergent aspects of pain. So what does that mean? Well, like I said before, there's a million different manifestations of pain, but really I only see one road to health. Because if you think about it, think about the body in terms of like a light bulb, right? We don't have 1,000 different ways to turn a light bulb on. There's one way that we do it. It's not a personalized thing. We don't start from scratch every time. There is a pathway to building a light bulb. We know what needs to be laid down. We know how it works. We're not recreating a light bulb every time. So, and it's the same with the body. The body is actually a bioelectrical, biochemical entity. And it works in a certain way, and it doesn't matter, what race you are, what gender, what your political ideas are, like none of that matters. It's completely irrelevant. Every human being runs the same way, just like every light bulb runs the same way. And if we can make sure that our bioelectrical, biochemical makeup is on that path to health, then we should, and I'm just going to preface this with should, be able to we should be able to fix any pain, honestly. So nobody's actually achieved 100% pain relief. So it's still theoretical, but that is the path that I'm going down, because I think that there is a road to 100% pain free if we focus on that as the goal, as opposed to how do I get out of this disease state? It's how do I perpetuate health so I don't ever enter into the disease state? And they're two completely different questions. And it might seem subtle, but it's important. All right. So in order to understand how to stop pain, we have to understand what pain is. And there's 3 different phases that we go through when there's pain. So for instance, there's the transduction phase, and that's where the pain signal begins. What happens here? Well, when you have an injury, let's say you have a cut or a burn or broken bones, whatever the case may be, that damages tissues. And then that triggers pain receptors, which are called nociceptors. And then that releases an inflammatory chemicals. And this is all perfectly normal. This is what happens when there's any type of injury. So we have prostaglandins, which increase pain sensitivity. So you're more aware. And, of course, you don't want to be more aware, but you need to be aware that there's pain. The bradykinins, which cause pain and swelling. So, if you twist your ankle, it swells up. Those are the bradykinins. Substance P will transmit pain signals. And then you have histamine and cytokines, which worsen inflammation. And that inflammation is really, really important in the beginning, right? Chronically, it's becomes a huge problem. But in the beginning, it's important to have that inflammatory response. It's almost kind of like it's saying to the immune system, hey, there's something wrong here. You need to come fix this. And then the immune system comes, if it's not suppressed, of course, and it fixes the problem. So that is a big part of the first thing that happens. So your key symptoms are going to be sharp, intense pain, swellness, redness, maybe heat because you have more blood flow going to that area. The second phase, which we'll go in more depth in the next slides, but is a transmission phase. This is when pain signals travel to the brain. So pain travels from the injury site through the spinal cord into the brain, and you have peripheral nerves, you've got your spinal cord, and then you have the thalamus, which is like command central of the brain. So it's getting all this information and it sends it to different areas for the brain to decide how to react. So your key symptoms here are going to be pain spreading beyond the injury site, reflex withdrawal, right? So some things you need to do faster than you can't put your hand on a stove and then let that travel up to the brain, and the brain has to decide what to do, and then the message comes back down. This is too long. So we have a reflex system. So if you do touch something hot, your hand will automatically pull away, and then the pain registers like a couple seconds later, because otherwise, we'd have some serious problems. We need to have that reflex, and we do have a reflex mechanism if it's intact. If it's not intact, because you have diabetic neuropathy or something, that's a problem. And then the perception modulation phase is the third phase. So this is where the brain processes that pain intensity and emotional response. So, if you think about it, if let's say somebody hits you by accident, and then they're really, really sorry, it doesn't hurt nearly as much as if somebody hits you and wants it to hurt, right? So if their emotional intent is to hurt you, it almost doesn't matter how hard or not hard they hit you. The emotional response might be more intense and more exaggerated. So there's an emotional response that goes with that. And that can be with any pain, right? So you might have long-standing chronic pain, and any little trigger could set off an intense emotional response. And it might be over exaggerated based on the trigger, but because you have an emotional buy-in to the pain, it can be worse. And the emotional response is very, very powerful. So that will determine whether, how intense the pain is and how distressing it is. And the limbic system is where your emotions are in the brain. So if that system is not overreactive, the pain might cause you to cry a little bit as opposed to have a meltdown, right? The brain also releases pain modulating chemicals such as endorphins and kephalins. Those are natural painkillers. They are similar to opioids. They have that same response. And then, of course, we have serotonin and norepinephrine, and they block pain in the spinal cord. We'll get to those two chemicals because they're really, really important, and they're affected by a lot of the things that we're going to talk about. So pain may feel worse with stress or fear. Distraction or relaxation can reduce or perceived pain, and pain intensity will vary from person to person, obviously. Okay, so what can go wrong in the transduction phase? So that first phase that we talked about is, where the pain is felt. So you might have hyperalgesia, which is excessive pain sensitivity, and nociceptor damage or dysfunction. So the receptors that receive the pain in the first place, if they're damaged or dysfunctional from, let's say, arthritis or neuropathy or some sort of autoimmune condition. Persistent inflammation and pain signaling can be altered, failure to activate pain responses, and chemical imbalances leading to neuropathic pain. So the inflammatory chemicals that we have, and we talked about them, those are your prostaglandins, your bradykinins, your histamines. They can become overactive active and amplify pain signals. And why does that happen? Well, you can have excessive inflammation, and we're going to talk about inflammation. Overuse of NSAIDs. Why? Because they can increase that prostaglandin production, especially if you stop taking them abruptly. So if you're taking tons and tons of NSAIDs and then you stop, and then you have a pain stimulus, you can have your pain perception might be over-exaggerated, much more intense than if you had never taken the NSAIDs in the first place. And an opioid-induced hyperalgesia, which is long-term opioid use, can certainly make your pain sensitivity worse. Nociceptor damage, if they're damaged, if those pain signals may be weak or absent, they might misfire, and you get that in diabetic neuropathy. So when you have diabetes, it affects the smallest vessels first. So, your fingers, toes, for men, the tips of the penis, the kidneys, the eyes, all of those vessels get attacked first. But it reduces pain detection. Chemotherapy can also do that. That can lead to neuropathic pain. Vitamin B12 deficiency. One way to tell if you have B12 deficiency is let's say you get a vitamin B12 shot, right? And then you start urinating and it looks like you have blood in your urine. Well, that's really just the B12 being filtered through. If you get a B12 shot and within 24 hours your urine's perfectly fine, you're probably deficient. And you could probably, up the B12. B12 is water soluble, so you can't become toxic with it. So there's, I take like 5 milligrams of B12 a day, but it can cause some diarrhea. So just to be aware of. Anyway, autoimmune conditions such as Guillain-Barré syndrome, multiple sclerosis, that can cause nerve dysfunction as well, and that can delay injury detection or chronic nerve pain. Persistent inflammation and pain signaling. So what's happening here? So normally pain decreases as inflammation resolves, right? But in some conditions, that inflammation becomes chronic, leading to persistent pain, and it can alter the healing process. Chronic inflammation could be from long COVID. Long COVID is basically a hyperinflammatory state, and the immune system is really overactive. Gut inflammation, if you have constant gut issues, gut dysbiosis, and your body's constantly trying to put inflammation out in the gut, that can cause excessive response in pain. So a lot of these things we have to address one by one, it's kind of like, well, my joints hurt. Why do I have to fix my gut? Well, this is why, because if you have inflammation of the gut, all your resources are going to putting out that fire, and you don't have enough resources to put out other fires. Let's see. So repetitive injuries or poor healing, such as tendonitis, chronic back pain, all of that stuff can get worse. Mast cell activation. I have a patient who has mast cell activation and that's from an overactive immune system. So if you constantly have fires going off in the body, the immune system is being constantly activated, and that can cause issues and failure of the body to really go after some of these bigger pain issues. When there's failure to activate the pain responses, the body fails to detect pain, which leads to decreased or absent pain perception. That can, again, be diabetic neuropathy, excessive opioid use, and then chemical imbalances leading to neuropathic pain. It can cause a false pain, or if you've ever heard of phantom pain, if somebody loses a limb but that limb still hurts, that can be a problem. But we also get that with nerve compression, so sciatic nerve, herniated disc, carpal tunnel syndrome, shingles, post-herpetic neuralgia. Viruses can damage sensory nerves. So these are all the things that we can work with and deal with in pain transmission that aren't very well addressed with just pharmacologicals. So what causes inflammation? Because this is a big thing. Like, if you can reduce inflammation in various parts of the body, then you should be able to reduce pain in general. So poor diet and processed foods. And I know nobody wants to hear this one, but your refined sugars, high fructose, corn syrup, white sugar, they spike blood glucose and they trigger an inflammatory response. So you have inflammation in the small intestine. And when you have inflammation of the small intestine, then you have permeability of the gut, and then proteins start leaking out, and then you get an inflammatory response in the blood, and it just causes a whole bunch of different issues and problems. Processed vegetable oils. So your seed oils, very, very high levels of omega-6 fatty acids, which are the bad omega-6. You want omega-3, you want omega-9, you don't want omega-6 fatty acids because they're very, very pro-inflammatory, causes a massive inflammation. And then your body has to go fight that, right? So it needs to control the omega-6 fatty acids. So stay away from the canola oils, any seed oil, grape seed oil, stay away from those. Any artificial additive, preservative, trans fat, again, causes inflammation. And, it stinks, because who doesn't want to eat Twinkies? They're great, but they cause it causes so much stress on the body to have to process that. So if your body's processing a Twinkie, it can't deal with your pain. So it has to choose, and your body will put out the biggest fire, right? So you might think that your biggest fire is sciatic nerve pain, but if it might be your immune system, it might be your gut, it might be that Twinkie in your gut. The body only has so much resources, and it will ration what it has to deal with what it prioritizes. And unfortunately, you don't have a say in how things are done. Like, your body has its own project manager, and it's not listening to you, and it's doing what it thinks is best in the interest of your body. So you have to give it more in order to deal with what it has to deal with. So you either need to take away, like stop eating processed foods and improve your diet, or you need to give it the raw materials that it needs, like your B12 vitamins, and there's a whole bunch of different supplements to think about, and that we'll talk about, that will help. Hidden infections in the state of Pennsylvania, 2/3 of us there's some ridiculously high, it's either 50% or 2/3 of us actually have been exposed to Lyme disease, or we're carriers of it. But it is ridiculously high. It is worth getting tested for Lyme disease if you have persistent pain and inflammation. So these hidden infections can be very powerful. H. pylori is another that's part of the gut, right? And that goes back to really good gut health. If you have H. pylori, this can cause massive inflammation. Maybe your house has mold in it. So if you're chronically sick, if you're sick a lot and people in your family are sick a lot, searching out mold is a reasonable thing to do, because if you don't get rid of that mold, no matter how good your body is at fighting infection, it just keeps coming back. And eventually you'll get to the point where you don't have any reserve capacity and you're unable to manage it. And then you get really sick. Toxin exposure, so heavy metals, arsenic, mercury, cadmium, all of those things, mold again, pesticides. This is where you want to really be particular about your food and what's on your food, and washing off pesticides and buying food that isn't pesticidal or doesn't have pesticides on it. Plastics, that's another thing we just can't get away from. The average adult has digests about 40 pounds of plastic in a lifetime. That's a lot of plastic, guys, especially when 50 years ago there was no plastic, and now it's everywhere. And now we have nanoplastics because there's so much plastic. We're practically plastic beings at this point. But it's very, very difficult for the body to break down plastic and deal with it. So it causes inflammation, and it comes at a cost. You're going to have persistent pain because your bodies can't break down the plastics that's in the body. High stress and cortisol levels, also big problems. Hormone imbalances, thyroid, testosterone, estrogen, progesterone. Estrogen and progesterone, obviously, if you're a female, but thyroid, insulin, these hormone issues also contribute to chronic inflammation, can be very problematic. Insulin can cause high blood sugar, increasing inflammatory cytokines. I mean, at some level, it's amazing that, we're all, that we exist at all, because there's so many things that can go wrong. The body's extremely, extremely efficient at doing what it does. It's very good at what it does. But there's one too many things at this point that's causing some major, major issues for us. And then, of course, chronic sleep deprivation. This poor sleep increases inflammatory cytokines, just like everything else. It will reduce melatonin, which is a hormone, and you need to sleep. That is where the body fixes issues. That's where it fixes major inflammatory issues. If you don't sleep, and anybody with pain will tell you if they don't sleep, their pain is way worse. So prioritizing sleep has to be a big one. So in the next phase, we have the transmission phase, and what can happen here. So you can have damaged nerves that fail to properly transmit, right? That's a huge problem. Or they send incorrect signals to the brain, or you have loss of pain inhibition, loss of endorphins, right? So the spinal cord and the brain can overact to normal pain signals. That can happen. And low-level pain can feel extreme due to overactivation of pain pathways. So causes of this can be fibromyalgia. What's fibromyalgia? There's a huge component of inflammation that is associated with fibromyalgia and different chronic pain syndromes. Prolonged opioid use, long-term stress and trauma, neuroinflammation. Neuroinflammation can come from infections, toxins, and mold exposure. So those can be, that's where you can get mild stimuli can trigger intense pain. Failed inhibition, so the failure of the brain to block pain can happen when you don't have enough serotonin and norepinephrine on board. These can be big deals. So if you think about, the question is, where is serotonin made? Well, 95% of your serotonin is made in the gut, right? So if you have persistent gut problems, you're going to have serotonin problems, which means you're going to have failed pain inhibition. You're going to have loss of endorphins, serotonin, norepi. Where does serotonin come from? So it comes from your food, right? So you eat foods that are rich in like tryptophan. Tryptophan is an amino acid. It comes from eggs, chicken, beef, turkey. We always talk about, after you eat turkey on Thanksgiving, you're really tired. Nuts, dairy, bananas, dark chocolate. Tryptophan has to compete with other amino acids to cross the blood-brain barrier, meaning that gut health impacts tremendously how much tryptophan is available. And if you don't have good gastric acid, and you can't break down your food and create the amino acids that you need to create serotonin in the first place, and then your body's got inflammation on top of it. That's how all this pain mechanism comes about. And this is where, it's like eat a good diet and exercise. And it seems like really, I don't know, like that advice seems really kind of condescending, but it's really true. And this is one of the reasons why, because of that conversion of serotonin from tryptophan comes from having decent gut health. It also requires B6, magnesium, iron, and zinc. Those are your cofactors for converting tryptophan to serotonin. If you don't have those vitamins, if those vitamins and minerals aren't on board in the body, or you didn't eat them, or they got lost because they are fighting infection and inflammation in other places, then you're not going to be able to create serotonin, and then you're going to have pain transmission problems. Norepinephrine is made in the adrenal glands for the most part, about 80 to 90% of it. And basically what happens is norepinephrine is made from, it comes from food, right? So fish, eggs, dairy, almonds, avocados, bananas, that kind of stuff. And basically what happens is you get an amino acid called phenylalanine, which gets converted to tyrosine, which gets converted to L-DOPA, which then gets converted to norepi. And this requires vitamin C, copper, oxygen, more vitamin B6. Vitamin B6 is a huge one. So if you're not taking a multivitamin, definitely look into it, because vitamin B6 will help a lot with supporting pain modulation. So low serotonin and epinephrine, they're actually very common in depression and anxiety as well, but it will lead to poor endorphin production and failure to block pain. So those can be very powerful. Spinal cord injury and nerve compression, these are responsible for transporting pain signals from the body to the brain. So that can also cause problems. There's not too much, when you have that issue, you just have to do the best that you can with that. But misfiring pain signals, even when there's no injury, you can get neuropathic pain, which feels like it's burning, stabbing, or electric shocks. So that could be your post-herpetic neuralgia, or shingles, as many people call it, complex regional pain syndrome. That can be extreme pain in the arm or leg after an injury, your phantom pain. It's very difficult to treat and often does not respond to painkillers. And then opioid-induced hyperalgesia, which is from long-term opioid use. And then you have these autoimmune nerve attacks, which can cause chronic pain and dysfunction. And a lot of that is related to inflammation. So inflammation like multiple sclerosis and lupus, these have a lot to do with the myelin sheath. The myelin sheath of your nerve cells, which go from, that's your white matter, it goes from neurons to wherever the endpoint is. That myelin sheath is made of cholesterol. And those of you that are on massive doses of cholesterol and cholesterol lowering medications might have some issues with loss of myelin sheath, and that can cause a lot of additional issues in addition to pain that you might have. You might have a trigger of multiple sclerosis. So main triggers of demyelination in autoimmune disorders like multiple sclerosis, Guillain-Barré, lupus, these different, you can have viral infections, can certainly set those off. COVID-19, Lyme disease, Epstein-Barr, herpes. You can have gut dysbiosis. And then there's the oxidative stress and neuroinflammation. This is a huge problem. So inflammation damages the cells of the brain that make the myelin. So the oligodendrocytes make myelin, and the myelin is made of cholesterol. So inflammation will destroy the myelin faster than the body can make it. And if you're on cholesterol lowering medications like statins, then you can't even remake it, because the body is being prevented from making it in the first place. So there's a lot of triggers for this. Also, there's heavy metals, mold toxicity, chronic stress. The cholesterol deficiency and myelin breakdown is a huge problem. So myelin is composed of about 70 to 80% lipids, which includes cholesterol, phospholipids, and sphingomyelin. Cholesterol is essential for myelin production and repair. So if you have pain from multiple sclerosis, this is something to look into. Lowering cholesterol too much can impair nerve regeneration. You know that from if you've ever taken statins and you've had muscle pains and joint pains, and then you get brain fog, a lot of that is due to a lack of cholesterol. If you are taking statins and it's determined that it's absolutely necessary, make sure that you take some CoQ10 supplementation, because statins will deplete CoQ10 because CoQ10 is made on the same pathway as cholesterol. And if you're blocking cholesterol, then you're blocking CoQ10. And if you block CoQ10, then you get excessive oxidative stress. And when you have excessive oxidative stress, then, it's just this cascade event. And it leads back to more pain. So something to consider. There's other nutritional deficiencies that will block myelin repair, and those are going to be your B vitamins, especially B12, folate, which is B9, your omegas like omega-3 and omega-9, alpha-lipoic acid is another amino acid that's needed for nerve signal transmission. So those are some of the things that you can use to improve different types of pain and get to the root cause. And the root cause is ultimately inflammation. All right, so we're coming towards the end of this, but what can go wrong in the modulation phase? So again, you can have excessive pain sensitivity, which is very common, malfunctioning of pain modulation, which we've talked about, pain memory formation, so that phantom pain and PTSD linked pain, that can be much harder to deal with, and it's not necessarily going to respond to improving inflammation, right? That's a whole nother issue that needs to be addressed, but that would be a key component to pain. So you might benefit from, let's say, ketamine therapy in this case, or neural therapy, which is something that we do at the Philly Wellness Center, or EMDR, which is the eye movement. That can also reduce PTSD-linked type pain. For neuroinflammation, there's a lot of ways to help with neuroinflammation, because chronic inflammation in the brain and the spinal cord can make pain worse. So if we can improve chronic inflammation and we can make the brain less hypersensitive, then we can get normal sensation back and reduce pain. Plus, you can also clear up brain fog and fatigue and depression, which often accompany these conditions. The dopamine reward system, so the pathways that use dopamine, pain becomes part of that identity. People with chronic pain often feel no motivation, no joy, no sense of reward. So that can be hugely problematic. And then, of course, sleep disturbances. Poor sleep, again, and it increases inflammation, and that goes back to what we were talking about before. So, what we can do to build resilience, manage chronic pain, and work towards perpetual health. So this is our perpetual health model, and it all starts with the basics. The basics are food, exercise, sunlight. And those, again, might seem super simplistic, but they are very, very powerful. These are the three things that energize the body. So if you think of the body as a bioelectrical entity, the things that charge the battery, and all your cells are batteries, the things that charge the battery are food, exercise, sunlight. These three things are absolutely necessary. There's also grounding. So you may have heard of grounding sheets or grounding shoes and grounding shorts. There's all this stuff, but yeah, and you can certainly buy that stuff, and it does work. It's very interesting. But you know what else you could do? You could walk in the dirt, and that's grounding, right? With your shoes off, like walk on the earth. That causes grounding. Leaning up against a tree, there's a transfer of electrons that regenerates the body's battery system, if you will. So those things are very simplistic. They're very inexpensive, and you can do those. All right, so what are some of the regenerative therapies that we do use? And we'll talk about these over the next couple of minutes that we have. So we at Philly Wellness Center, we will look at peptides, neurotherapy, ozone therapy, soft wave therapy, PRP, PRFM, exosomes, stem cells, and regenerative protein arrays. And I've had people ask me if all of these things are legal, and they absolutely are legal. We use them and they work. So how do regenerative peptides work? So regenerative peptides are short chains of amino acids, right? So they signal the body to repair, regenerate, and restore tissue at the cellular level. Unlike traditional medications that really just mask symptoms, peptides stimulate natural healing processes by activating growth factors, stem cells, anti-inflammatory pathways. And most of them don't have any side effects. They don't interfere with other medications, and they're very short acting. So they go in, do what they're supposed to do, and then they disappear, just like amino acids. So if you eat turkey and it turns into amino acids, that doesn't interfere with if you're taking Seroquel or something, right? Like you eat, you create amino acids, and they go to work, they do their thing, and then they disappear. And that's exactly how peptides work. So they can activate growth factors, stimulate stem cells, reduce inflammation. They can enhance mitochondrial function. They can create mitochondrial biogenesis. So you can actually create more mitochondria if you need them, and improve nerve regeneration, help repair myelin, improve nerve function. So regenerative peptides can help speed up recovery from injuries, surgeries, chronic disease, neurodegenerative disease. And there's peptides for everything out there. There's BPC 157 is great for healing. TB 500. I like thymosin alpha 1. That is an immune system. I like taking that on a daily basis. Of course, you've heard of peptides like semaglutide, tirzepatide, retatrutide. Those help with weight loss. Melanotan has a lot of uses. One of the uses is tanning. Like it tans the skin, which is interesting. But it's something that can be done. KPV, very anti-inflammatory. GHK-Cu is a tricopper peptide that is extremely powerful in upregulating genetic information. And that's the GHK-Cu. We use it a lot in skincare because it'll tighten skin. But if you inject it, it does help upregulate genetic factors, and can also help with decreasing inflammation. And it can also help with some pain modulation. So there's tons of them. There's a MOTS-C, can help generate more mitochondria. It can repair mitochondria functioning. So if you have an energy production problem, or you have high triglycerides, MOTS-C can actually help quite significantly. And these are, the top peptides that I was just talking about that we use. Let's see, what else did I miss any on? So AOD 9604 is a fat burning and also cartilage repair. So if you've done significant damage to your joints from steroid injections, 90604 will help a lot. Cerebroliacin has been used extensively overseas for stroke patients, any kind of TBI, dihexa as well for mental health. Very, very powerful medication that is new that we've been able to get. They've been doing some studies in Alzheimer's and Parkinson's disease. It does improve focus, creativity, and cognition. As an everyday medication, these can get very expensive. A lot of this stuff is going to run you somewhere between $200 and $300 a month. If you're taking them every day. A lot of times we'll cycle them for 12 weeks, but it's good to have a goal. Like, what is the goal here? What is the point? What are we trying to achieve by using these different peptides? So it's not something you necessarily stay on for the rest of your life, but maybe to help you figure some things out. Now we also do IV therapies, and we do a lot of different, I don't do routine, your generic hangover drips. I do stuff like CBD IV therapy, right? So there is an IV therapy that uses CBD. It's not THC, so it's not going to make you high, but it is potently anti-inflammatory. So if you do have inflammation, you have pain because you have significant inflammation for whatever reason, doing a CBD IV will help modulate that cytokine production, reduce inflammation. It inhibits some pain signaling and can enhance serotonin function. So that's something to think about. It's great for arthritis, joint pain, neuropathy, fibromyalgia, autoimmune disorders, anxiety-induced pain, anything that's muscle tension, stress-related. And it won't damage your gut like NSAIDs will, and it's not going to increase cardiovascular risks. Curcumin IV is also a really, really wonderful medication for chronic inflammation. Very, very powerful. If you like curry, you can certainly eat a lot of curry. There's a lot of curcumin in that. Just make sure you activate it with black pepper. So black pepper and turmeric need to be used together in order for it to work, but it is good for post-surgical pain, neuroinflammation. I actually take curcumin pills every night. I like those a lot. I think they help significantly. Peptide. So I do have IV peptides that we do. We have an IV peptide. It's called a Jumpstart, and that's really wonderful for healing. Also reducing inflammation, and it's like this massive energy boost, which is really, really nice. I do like it. So if you need a huge energy boost, peptide therapy IV is wonderful. Glutathione. So if you're on Tylenol or acetaminophen, or you have massive amounts of oxidative stress, a glutathione drip is amazing. Like it will change your life. It feels really good. NAD. So a lot of people talk about NAD. It's not my favorite thing. I mean, it definitely gives you a boost of energy, but I mean, if I had to choose between NAD and peptide or glutathione or curcumin, I would take one of those others. The NAD it's a tough medication to take. It's a very complex molecule, and when you're getting it, it could take up to a couple of hours for you to get an NAD infusion in completely, because it can cause transient. It's like a real transient chest tightness, and it's all rate dependent. So if you do get chest tightness, we have to slow the drip down, and that can take a while to get it in. Neural ozone therapy. This is another thing that we do. So neural ozone therapy is a cutting edge treatment, uses medical grade ozone. Ozone is a gas. It's an unstable oxygen, but it promotes nerve healing, reduces pain, and lowers inflammation in the nervous system. It's particularly effective for neuropathy, chronic pain, neuroinflammation, and spinal cord injuries. So we like using that. I like using ozone in arthritic joints, a lot of pain. If you have a lot of pain in like a shoulder, torn cuff, ACL, joints, anything like that, using ozone therapy is wonderful. So we'll use a procaine first. We'll inject procaine, and then a lot of times I'll inject some of the peptides that we talked about. So I'll inject BPC 157 or IGF or MOTC into a joint to help with healing or whatever the case may be, and then follow it up with vitamin B12. B12 inside a joint is very, very healing and powerful. And then the last thing is to infuse the ozone gas directly into a joint or area of pain. So I have done like sciatic nerve. I treat my dad with sciatic nerve pain, and we'll do a neural ozone therapy. So he gets an injection in his butt of the procaine, followed by BPC 157, followed by vitamin B12, followed by ozone, and that really holds him over. So he's still able to play golf. Doesn't need back surgery. It's helped quite significantly. So I'm very, very happy about that, because he's a very traditional kind of guy when it comes to medicine. SoftWave is the new machine that we have in the office. I do believe we're the only clinic in the city with this. It's an advanced non-invasive regenerative treatment. It uses extracorporeal shockwave therapy to stimulate tissue repair, reduce pain, and activate stem cells. And actually we can inject stem cells and then do shockwave on top of it, and it works even better. Like it's stem cells certainly work well by themselves, but you do stem cells and shockwave, and there's like a 10x increase in pain reduction. So this is widely used in orthopedics, sports medicine, neurology, and regenerative medicine. So all the sports teams use shockwave therapy for conditions like arthritis, chronic pain, neuropathy, and especially soft tissue injuries. It's really great for that. And it doesn't just block pain, it actually regenerates damaged tissue. My dad's orthopod was not happy that I was doing this and was like, oh, that's a Band-Aid. It doesn't really do anything. But that's not true. It does actually regenerate damaged tissues, and that's the whole point of it. It uses an electrohydraulic shockwave. So lithotripsy is a very, very high level, very strong acoustic wave, and you would need to be sedated for that. Lithotripsy is very, very painful. But soft wave is low intensity, but acoustic waves, and it does not hurt at all. But when you get an area that's injured, it will create a sensation there that's different than other tissue. And we're really searching for that a level 5, I guess, pain level. So when you first start out, most people, they'll be at a 0. 0 being no pain, 10 being the worst. We're looking for a 5, 6 level, and then we hold the shock wave there. We hold the focus beam there for a while, and it helps to stimulate and mobilize the cells. It activates the body's natural healing process. It can break up scar tissue. I do have a woman that has trigeminal neuralgia in the face, and we've been using it on that. And she says it feels like it's breaking something up. And what I think she means is that it's breaking up scar tissue, or microcalcifications, reduces fibrosis. It just really helps to loosen up the area. And she's had a lot of success with just using soft wave for trigeminal neuralgia pain, which is really, really painful. It can also provide rapid pain relief and nerve regeneration. It blocks pain receptors, can desensitize overactive nerves, which we've talked about. It can regenerate myelin sheath, which is really, really powerful. So yeah, it's really great for neuropathy or multiple sclerosis patients. It can help with sciatic and nerve compression, though I will say, at least for my dad, the neuroozone therapy worked better for the sciatic nerve than the soft wave. But the combination, we kind of go back and forth now, so it's getting harder to tell which one works the best because we keep going back and forth with it. But joint and cartilage regeneration, muscle and tendon repair, faster recovery and then it increases circulation and lymphatic drainage. All right, just a couple more slides here and then we are done. So PRP, this is your plasma, your own plasma that we can use. I've injected this in backs and different joints, so I can create a matrix from your plasma, and it serves as a time-released PRP. So sometimes what I do is take your plasma, spin it down, create a matrix, mix it with PRP plus stem cells or exosomes or peptides. And then as that PRFM starts to break down over months, it's almost like this time-released peptide factory, if you will. So it's a really wonderful regenerative therapy that uses your body's own growth factors to repair tissue, reduce pain, and promote healing. So PRP is just your blood. I guess it helps if you're in a healthy state to use PRP and PRF, so that it might not be the ideal thing for you in the beginning, but if you're a healthy person, using your own PRP can be very effective. These are exosomes. So exosomes are cutting-edge regenerative tools that use cellular messengers, much in the way of peptides, but they are tiny extracellular vesicles that are released by stem cells. And they go and they have messenger RNA, microRNA, and they tell cells what they're supposed to be doing. Like, hey, you're supposed to be, fixing this inflammation. You need to get to work. And then, of course, stem cells. So I had a guy who was getting ready to go to, Panama or something for stem cells. And I'm like, I offer stem cells at Philly Wellness Center. They're legal. They are what the FDA say experimental. So, and I can't tell you that they'll cure anything, But if you read up on stem cells, you find that this is what you want to do. We certainly offer stem cells. They are legal in the US. You just have to sign something that says you understand they're experimental, and then we can make a provider-patient decision if this is the right thing for you. So stem cells, how they're supposed to work, they rebuild damaged tissues, reduce chronic inflammation. We can give them IV. I can inject them into joints, muscles, tendons, anywhere you want stem cells, we can inject them. It stimulates angiogenesis, which is new blood formation, blood vessels, recruits healing cells, prevents scar tissue. It can treat, well, I can't say treat. It can be used in conditions such as arthritis. So they can help regenerate cartilage, slow arthritic progression. It can accelerate tendon healing, strengthen collagen fibers. It promotes myelin regeneration, autoimmune. It can calm down the immune system and prevent excessive inflammation. And then, of course, it's a very expensive treatment, but you can use it for hair restoration and skin rejuvenation. There's also a lot of other things that we can do for those. But you can do intra-articular, which is into the joint, IV, intramuscular, scalp injections. We can microneedle it, stem cells into your face. Whatever you want it for, whatever you need stem cells for, we can help you with that. Regenerative protein arrays. So these are basically what they do is take a placenta, they put it on a bioreactor, and the placenta stays alive, and it's constantly generating protein arrays. So it's excreting protein arrays. So that's cytokines, growth factors, and those are collected. They're not live cells. So there's no risk of like transmitting diseases, and there's no risk of like tumor formations or whatever other crazy things that they think happen with stem cells. But, they basically deliver concentrated healing proteins to target areas. So we can inject them in joints, muscle, we can inject it into your spinal fluid, and we can do nerves, skin, whatever the case may be. These are much more expensive than stem cells. Stem cells, I actually think I have prices on here. So yeah, Philly Wellness Center. So some of the things that we do, and I do have prices so that you'll get a ballpark figure of what all of this cost. So for peptides, we do injections such as, just vitamin B12, vitamin D, glutathione, actually anything you can think of, we have access to. And we can get those injectables for you. So if you need weekly injections, peptide injections, they can be, a lot of times we do 5 days on, 2 days off, so 20 days a month. And those generally start around maybe $150, $200 per month. IVs range pretty much from $150 to $300, except for when you get into stem cells, those get much more expensive. Neurotherapy uses procaine injections plus ozone, plus we can add peptides to that. Again, I love BPC 157 in joints to heal, IGF, which is insulin growth factor, TB 500, which is thymosin beta 4. And we can use those, and that an injection of neural ozone therapy is $150. Soft wave treatment, those are $100 per session. That can also be used with peptides, IV, neurotherapy, ozone, the biologics, whether it's PRP, stem cells, RPA, exosomes, whatever the case may be. And then these are the biologics. So PRP, if we're just doing PRP and injecting that into the back, or wherever you need PRP, even if you want your facial to, or your microneedling, and we're doing that, or hair restoration, every time we do PRP, it's $500. If we do the matrix, it's an extra level, and that takes the price to $250. But the matrix takes about 3 to 4 months to degrade, so it's great for stabilizing a joint, especially if you have bone-on-bone type of injury. That's really great to create the matrix first before doing stem cells, so they don't just go to waste. Exosome therapy, 1,000, and those are the vesicles that come from the stem cells. If you want the actual stem cells themselves, we can do, again, infusions, injections, Those are 2,500, and regenerative protein arrays, which is all three layers of your basic cell, which is mesoderm, ectoderm, endoderm, whereas stem cells are mainly just for mesenchymal or mesoderm layer issues, and that's stuff that we talk about. You don't have to remember any of this. My goal isn't to, say you need the most expensive thing. My goal is to say, what is the problem? And, what is it that we're going to do to help you to solve that problem? And if it's an inflammation problem, you might just need supplements, right? And, if it's really severe and you have a lot of disease manifestation, we might need to calm the system down. You might need a curcumin IV. You might need a stem cell IV, to dramatically alter the course of your condition. But that's something that comes with an evaluation. So for our February bonus, February 2025, if you're watching this now, we are doing free pain evaluations and free soft wave sessions. So this is a $250 value. So you can come in and we can tell you what it is that you need, right? We don't have to guess. We don't have to, this, that, or the other thing. It's come in, let's evaluate the pain. What is the source of the pain? What is going to alter this trajectory of pain that you have? We can try soft wave, like to see if that works. If it doesn't work, that's fine. There's no harm, no foul. If it does work, it's a relatively inexpensive treatment. And a lot of this stuff is you do it and then, you might need 3 sessions. You might need 5 sessions. You might need 10 sessions. I don't know. It depends on how bad the pain is. But what happens is a lot of times is that you'll get a session, and then maybe you need the second session like 3 to 5 days later, but then you don't need the next session until a week later. And then you don't need another session for a couple weeks. And then you don't need it. Maybe you need it once a month. Maybe you need it once a quarter. Maybe you just don't need it ever again because we fixed the issue. And that is the goal. The goal isn't to have you come back and buy something every month. It's to let's fix the problem. What is the pain problem that we can address? That will make a difference in your life. And if you don't address that underlying cause, and I am a big believer in supplements and proper diet and nutrition in order to fix all of these things. But a lot of times you're so far off the perpetual health pathway that if you're all the way over here, we need to bring you back here, and then you can go down that pathway of supplements and how do I live to be 300 or whatever the case may be. So that's it, guys. Hopefully this was helpful and interesting to you guys. That is what we have at Philly Wellness Center. So for February, if you want to scan the code, I think I have this on the last slide. Yeah, you can go ahead and scan that, book an appointment with us. It will be free for you. Just mention that you watched this webinar, and we will do the free evaluation. We can work up your pain, give you a supplement protocol, offer any of the regenerative therapies that we've talked about tonight. And we'll do a free soft wave. Why not? Let's do that. See if it works. See if that's the right path for you to be on. So I really appreciate you guys being here with me tonight. If you do have questions, please feel free to put the questions in the comments section. And if not, feel free to contact us anytime. Book your appointment in the month of February. Come out and see us. We are on 8th and South. And I look forward to any questions that you guys have, and hope you all have a really great night.